to blatantly out loud profess that we need to have a more racist policy for public health I just can't accept that.
Democratic Senator Rosemary Bayer talking about an amendment to legislation that would eliminate the use of the Social Vulnerability Index to determine where vaccines go. The index weighing such factors as poverty, minority status, transportation, and crowded housing. A supporter of the legislation, Republican Jim Runstead, calls the index antiquated and says it doesn't apply to the pandemic.
This cockamamie 20-year-old concept is distributing them based upon hurricanes and all of this when we're dealing with a very specific virus.
But Senator Bayer argues that scientific data supports the index.
They're picking the part that they like, and they're ignoring this other huge body of data that shows that there's so many other factors that matter.
According to the CDC's calculations, American Indian or Alaskan Natives and Hispanic people have over a 2 times chance of dying from COVID-19. Both of those groups are hospitalized at a rate of over 3 times the rate of Caucasian people. But on the other side of the aisle, Senator Tom Barrett says the CDC also shows that only people older than 65 should be prioritized.
The population in your community that is above age 65 should be the factor we use to determine the distribution of the vaccine. Not your household income status, certainly not your race, and certainly not these other factors that they came up with.
The amendment now heads to the House for approval. Kendall Keys, WNEM TV5.